Thank you. Mrs. Ashmore.
I want to add a few things to Dr. Cioli's remarks. Right on target with tax credits, tax subsidies. I would like to kind of change hats from being in the insurance industry to being a business owner for you for a moment. My husband and I have 30 employees. My health insurance tab is pretty healthy. Average age of our own group is over 50. Average, over 50. We're sick. Our rates are horrible. So I'm feeling your pain. My number one thing, putting my business owner hat on here for a moment, is for the government, it's state, local, state, and national, to support business to hire these people in the first place. We don't have a business-friendly environment. And every time we turn around, we're looking at more and more taxes that are crippling business owners' capacity to expand and add workers. It's crazy. So I would say to you that we need to support any and all options to keep these people in the private market and hire them, train them, educate them, put them to work. Facilitate the small business owner. Now, another thing on this Medicaid issue. We're talking great guns here on expanding Medicare. If you take a look at House Bill 3200 and the new Baucus bill that was just recently dropped, or going to Chairman's mark, there is an awful lot of discussion in there about expanding Medicaid. Now, step back just a few weeks and remember all of the things in the news about what's going on in California. California has capped CHIPS and capped Medicaid. Rhode Island has sent their employees home. We have unpaid furlough in a number of states. The states support and pay the tab for the majority of Medicaid. So for the government to sit there and expand that is going to put a huge financial burden on the states as well.
Thank you. Dr. Bessler.
Well, it's clear that we presently take care of the poor and the immigrants via Medicaid, philanthropically supported free clinics, hospital emergency services, unpaid care by physicians and hospitals, and assistance by families and friends. In 41 years of medical practice, I have never encountered a patient who needed health care who was denied it by a physician. If it's outside of our specialty area, we go out of our way to find a referral to a physician who can take care of the problem. The mandatory insurance that our president spoke to so eloquently the other night, everyone would have to take out the insurance. Well, let me agree with our insurance person here. A 20-year-old who is healthy and hasn't had to see a physician for any reason for a year or two would be a damn fool to pay $5,000 a year premium, which once paid goes down the tube year after year while he or she is trying to pay off college debts, earn a living, get by. Did you stop and think of what an insult financially that would be to the young people in the United States on whom we have to build our future? The complaint of the poor not receiving health care, not having health care because they don't have insurance. Right after the Watts riots some many years ago, I visited Watts and visited a clinic that the government had built for them as a kind of a, gee, forgive us guys, we haven't dealt with you fairly. We had just opened our clinic at the University of Missouri and we thought we had top of the line equipment. My gosh, this was deluxe. the best of everything, manned entirely with black physicians and black personnel. I asked one of the black physicians, "My, this is beautiful. You must be quite busy." And he said, "No, we're not." I said, "Why not?" He said, "Well, for example, while the building was going up, the lady across the street was sitting in a rocking chair in her front porch, watching the building going up. And after it was built, we thought she'd probably come over. And we went over to her because she had a thyroid tumor out to here. She didn't get out of her rocking chair to go to the free clinic across the street. He said they had to go door to door, ring doorbells. Does anybody need health care? Anybody in the house sick? Anybody need health care? They had to go out and beg people to come to the clinic. You figure it.
Thank you for the perspective. Do we not have a great panel here, ladies and gentlemen? We're going to go on to the final question of this session, and when we conclude this, we will take a 15-minute break. Federal and state mandates have complicated and greatly increased the cost and complexity of health care insurance, as we already have heard from the panel tonight. Here again, the government is the problem and not the solution. The sixth question, and I'm going to start with Mrs. Ashmore, and we'll conclude with Dr. Scioli. What constitutes acceptable health care insurance coverage?
My first response to that question was whatever your risk tolerance can bear. We have an environment where people have become so dependent on small copays for this, that, and the other that we've completely lost touch with reality. Now, the back end of these insurance contracts at this stage of the game have usually $5 million to unlimited lifetime maximums, and the difference between the two, quite honestly, is about 50 cents in your rates. There's a deductible variation anywhere between $250 to $10 grand that you can choose from. And I completely agree with Dr. Scioli that health savings accounts are the way to go because you get engaged in your care and you start asking questions. Believe me, you start asking questions when you write the checks. So I think at some point, when I first started in the insurance business, there were no copays. There were no networks. You had a deductible. It was 80%. It was usual, reasonable, and customary, which is a large part of what kind of drove us into the network issue we're looking at now. And you had an out-of-pocket and you were done. But you knew when you had a claim, it was like the vehicle insurance, you had $500 off the top. You just knew that going in. So I think one of the things that would constitute good solid coverage is how we design the benefit contract on the catastrophic end and all the illnesses and the mandates and stuff that are built into it. Now, in Texas, I believe we have 64 state mandates. We're one of the highest. I think maybe Minnesota beats us. All of those mandates have hidden costs. So again, I go back to the importance of us really evaluating what our expectations of what our insurance company needs to provide. We also have a lot of discussion that needs to take place on tax incentives for individuals, and I will relinquish the rest of my time.